Hi, my name is Brooke Ryan, and I'm a student at Texas State University working towards becoming a psychiatric and mental health nurse practitioner. I currently work as an admissions nurse at a psychiatric hospital and previously worked at Austin State Hospital for 2.5 years. Texas was ranked 50 out of 51 in access to care according to the data collected from Mental Health America. The states were ranked based on access to insurance, treatment, and special education, as well as quality and cost of insurance and workforce availability. While working at one of the state hospitals, I was able to see firsthand how broken the system is in Texas. The issue I witnessed and became most passionate about, however, was the process for court-ordered medication in patients that have been ordered by the courts for inpatient mental health treatment. After being arrested for a criminal offense, approximately 20% of those evaluated for competency are found incompetent to stand trial, and the majority of those defendants have severe psychotic disorders. In Texas, one of the options for competency restoration is to receive treatment at one of the 9 state hospitals. The primary treatment strategy to restore competency is medication. But in the state of Texas, court-ordered inpatient treatment does not include court-ordered medication. This is a separate order that is often up to a state hospital physician to initiate. According to an April 2019 report issued by the Texas Health and Human Services Department, the average number of days people waited for a bed at a non-maximum security forensic state hospital was 49 days. Once arriving at a state facility, it can be another 2 to 3 weeks before receiving court-ordered medication. This becomes an average of more than 49 days of being ordered for inpatient care with no medication. I have seen firsthand how medication can change a psychotic, paranoid, delusional, and dangerous man into a reality-based, pleasant, and enjoyable person. Medication can be so incredibly life-changing, yet the state of Texas prolongs this process, causing undue trauma and injury for both patients and staff. One example is a new patient that my unit received who was unable to carry on a reality-based conversation for even a moment. He was paranoid and very aggressive. He punched one of his roommates, a quiet, unassuming man, causing facial injury and bleeding. He was restrained one day, which caused injury to a long-term staff member who was unable to return to work almost after a decade of incredible service. Restraints at this level often involve a restraint chair where patients are strapped down on both hands, feet, waist, and chest. They often receive injections of emergency medication. All of this is traumatic for both the patients and staff. This particular patient was ultimately ordered to be on court-ordered medication. He quickly turned around and was able to have full, lucid, reality-based conversations. We talked about Seinfeld and running, and he was funny, pleasant, and kind. If he had been court-ordered for medication from the beginning, at the time of being ordered for inpatient treatment, maybe staff wouldn't have been hurt to the point of being forced to quit. Maybe his roommate would have not been punched in the face, and maybe the patient would have been placed in fewer restraints. This is just one patient on one instance at one state hospital. I'm aware this is a very complex issue. Any changes would be very involved, making this an incredibly time-consuming and difficult undertaking. But I chose this topic because of what I witnessed and how passionate I am about the mental health services in Texas. If people shy away from tough and challenging topics because they're told it's too hard, then change will never happen. Yes, much more research needs to be done, but change has to start somewhere, and I'm hoping my voice will help get people thinking and start the process. Thank you.